Around the world, governments have completely different ways of dealing with drugs and addiction. Some countries give users treatment and safe supplies, others use prison sentences and harsh punishment. But which system actually works best? In this video, we're looking at how different countries deal with addiction, the impact these methods have on society, and which approaches are the most effective. In 2001, Portugal faced a massive heroin crisis. Overdose deaths were rising, HIV infections were spreading, and prisons were overcrowded. Instead of increasing punishment, Portugal did something unexpected. They decriminalized drugs. This does not mean drugs became fully legal. Selling drugs was still illegal, but if someone was caught with a small amount for personal use, they were sent to treatment instead of jail. Portugal started treating addiction as a health issue instead of a crime. And, surprisingly, it worked. Overdose deaths dropped, HIV infections decreased, drug-related incarceration went down, organized crime also became weaker because users relied less on dangerous street drugs. Decriminalization is considered one of the most effective systems in the world, but it works best in countries that already have strong healthcare systems, treatment programs, and social services. Without rehab centers, mental health support, and housing programs, simply removing criminal penalties may not solve the addiction problem. So, while Portugal's model works very well there, poorer countries may struggle to copy it successfully. Some parts of Canada and the United States use a strategy called harm reduction. The goal isn't necessarily to stop drug use immediately. The goal is to reduce deaths and keep people alive. Programs include safe injection sites, needle exchange programs, and government-supplied safer drugs. These programs reduce HIV and hepatitis caused by shared needles and lower overdose deaths from contaminated street drugs. Harm reduction is considered very effective at preventing medical emergencies and disease spread. It's also cheaper than repeated hospital visits and emergency healthcare. However, harm reduction is most effective in areas already dealing with severe addiction crises, especially large cities with high overdose rates. In places with strong stigma against addiction, these programs can face public opposition because some people believe they encourage drug use. Harm reduction also doesn't completely solve addiction. Instead, it focuses on preventing the situation from getting worse while helping people eventually access treatment. Some countries, such as Uruguay, use legalization. This means drugs are legal under government regulation, but the government doesn't directly provide them. The idea behind legalization is to weaken black markets by replacing illegal dealers with regulated systems. This can reduce gang violence, organized crime, and pressure on police and prisons. Legalization also saves the government lots of money because less is spent on drug enforcement. But legalization has mixed effectiveness. It works best in stable countries with strong regulation systems and lower levels of organized crime. Even when drugs become legal, illegal markets can still exist if legal products are too expensive or difficult to access. This is why legalization usually weakens black markets instead of eliminating them completely. Because of the political risks and uncertainty of its effectiveness, legalization is still one of the least used drug strategies worldwide. Countries like Singapore, China, and Iran use strict criminalization or war on drugs. In this strategy, drug possession leads to severe punishment, including long prison sentences and, in some cases, the death penalty. This strategy is based on the idea that fear of severe punishment will stop people from using drugs. In some strict countries like Singapore, visible drug use rates are lower than that of Western countries. Because of this, criminalization can appear effective in highly controlled societies with strong law enforcement and low public tolerance for drugs. But overall, studies show major problems with this approach. Criminalization is extremely expensive. because governments spend billions on policing, courts, and prisons. It also creates overcrowded prisons, criminal records, and strong black markets that continue operating despite harsh laws. This is because in poorer areas with homelessness and poverty, criminalization is often less effective, as many people rely on the drug trade for income or use drugs to cope with difficult living conditions. This is why many experts criticize the war on drugs for punishing users without addressing the root causes of addiction. So, which strategy works best? Addiction is a complicated issue, and no single solution works perfectly everywhere. But evidence shows that countries focusing more on healthcare and treatment generally see better long-term results than countries relying mainly on punishment.